Today, I would like to talk about failure of host defense mechanisms. A long time ago, in a galaxy far, far away, humans' immune system protect the host from the foreign invaders. It is a constant battle of good and evil, the good being the immune system, and the evil being invaders such as bacteria and viruses. Evil invaders are slick and clever, coming up with different ways to slip through the immune system and gain their way. Invaders are trying to enter your body, stay and live there, multiplying in numbers. Of course, our body does not want that, so our immune cells and proteins are constantly patrolling around our body, detecting invaders and destroying or neutralizing them. But when do our immune system lose to the invaders? How can invaders overcome our protector immune system? When do these guys get a chance to habituate in our body without being destroyed or neutralized? Today, I will cover 3 topics: evasion and subversion of immune defense by pathogens, inherited immunodeficiency diseases, and finally, HIV and AIDS. So, the first topic is evasion and subversion of immune defenses. Let's change the point of view and look from the bacteria's side. You are trying to enter and invade this human being, but there are innate immunity and acquired immunity you have to hide or fight against. So what would you do? The first way of avoiding host immune system is having antigenic variation. It is particularly important for extracellular pathogens, which are generally eliminated by antibodies against their surface structures. One example of antigenic variation is serotypes. Serotypes are the same bacteria but has slightly different capsular polysaccharides. Streptococcus pneumoniae is a good example of having many different serotypes. Saying Streptococcus pneumoniae is like saying dogs or human. There are different types of dogs as well as different types of human being. Some are black, some are white, some are brown, and so on. Your acquired immunity will make B cells produce specific antibodies targeting specific pathogens. That antibody may be able to target one person, let's say him, but not the other, because their capsular polysaccharides are not the same. So the antibody can bind with his polysaccharides, but not with hers. So when hundreds of him come to you to invade your body, your one antibody will work perfectly fine to eliminate him. However, if this entire group come to your body for invasion, then your acquired immune system may be overwhelmed and lose. Another form of antigenic variation is especially important feature of the influenza virus. Antigenic drift is caused by point mutations in the genes encoding hemagglutinin and a second surface protein neuraminidase. Although person P may be able to neutralize virus V using the antibodies which binds with the surface protein of virus V, which they use to bind with our cells, when this virus goes through antigenic drift or point mutation in some other person, then this virus will be able to infect person P, because then our antibody does not work against this new form of virus. Viruses keep mutating, and this is why we never get permanent immunity to influenza. Antigenic shift is more serious compared to antigenic drift. It is caused by major changes in hemagglutinin of the virus, making virus poorly recognizable by immune cells. This is caused by reassortment of the segmented RNA genome of the human influenza virus and animal influenza virus in an animal host. That's why we call it swine flu or bird flu when this occurs, and usually this causes global pandemics of severe disease. Another way of avoiding host immune system is when they enter a latency stage. After virus entering the cells, they replicate their DNAs or RNAs to multiply in numbers. However, by doing so, they expose themselves at risk of being detected by immune cells. However, some viruses like varicella zoster virus and infectious mononucleosis can enter latency state, meaning they stop replicating and therefore they cannot be detected by immune cells. Occasionally, when our immune system is suppressed, then they take this as a good opportunity and start multiplying again, just like cold sores or shingles. If it does not show on MHC class 1, T cells or natural killer cells cannot detect them, and therefore they are sort of like invisible. There are varieties of ways that invaders subvert our defense mechanisms. Some viruses like herpes simplex virus, cytomegalovirus, and vaccinia may inhibit humoral immunity like complements and antibodies. Some viruses may inhibit inflammatory response like cytomegalovirus, vaccinia, and Epstein-Barr virus can do. The other may be blocking antigen processing and presentation at MHC class 1 level. For example, herpes simplex virus and cytomegalovirus can also do this. And finally, Epstein-Barr virus can also cause immunosuppression. For example, when viruses enter the cell and start replicating, cells will present its part of DNA, including viral DNA, on MHC class 1 to be recognized by natural killer cells or cytotoxic T cells, just like sending them a help signal to tell them that they are infected. This way, immune cells can recognize infected cells and destroy them. However, herpes simplex virus or cytomegalovirus can inhibit this process and make themselves invisible or non-detectable. Like this. Well, as I mentioned in the beginning, it is a constant battle of good and evil. Although our immune system fight hard against invaders to protect our body, they too come up with the slick tactics to slip through our immunity and invade our body, either by having variations like serotypes, or changing their DNA or RNAs by antigenic shift or antigenic drift. They can become invisible by entering latency state, or they can alter our immune response system. You can get vaccination for influenza, but it may not even work if it's not the right type, and also it is painful. I would be laughing at his face if I were his classmate, except I was next in line. Now, moving on to the second part of the presentation, immunodeficiency diseases, which is focused in inherited immunodeficiency diseases. Most of the inherited immunodeficiency diseases are caused by recessive gene defects. Many are caused by mutations in genes on the X chromosome. This means that the female only becomes a carrier because they have two X chromosomes and mutation being overruled by the healthy X chromosome. It is only the male who will actually become symptomatic because they only have one X chromosome and they do not have alternatives. There are many inherited immunodeficiency diseases. However, it'll be too time-consuming to go over all the diseases, so I will give a brief overview. As I said, most of these conditions are genetically driven, recessive gene defects. They may lack T cell or B cell formation or have altered functions of these cells, like X-linked agammaglobulinemia, X-linked lymphoproliferative syndrome, Bloom syndrome, ataxia telangiectasia. They may lack MHC class 1 or class 2. Antibodies such as IgG, IgA, IgM may be lacking, like common variable immunodeficiency, selective IgA, or they may be lacking phagocytes or complements. In any of these cases, they will not have immune response they need to have to go after the pathogens. If they have MHC class 1 deficiency, cytotoxic T cells or natural killer cells cannot detect infected cells, and therefore they cannot eliminate invaders. These people may be susceptible to chronic lung infections or skin infection. If they have MHC class 2 deficiency, helper T cells cannot recognize what type of invaders they are dealing with. If they knew what they are dealing against, then they can initiate the immune response specific to the pathogen. They can initiate the chain of inflammatory reaction or even command B cells to create specific antibodies. However, if they don't know what is invading their body, then they have no clue to trigger what type of response to eliminate these invading pathogens. So basically, they cannot trigger the alarm signal of invaders. In other cases, you may be lacking B cells to fire antibodies, like in X-linked agammaglobulinemia. Or you may be only lacking bullets, meaning antibodies, like in hyper IgM syndrome, common variable immunodeficiency, selective IgA, or Bloom syndrome. So most of these conditions are inherited in recessive trait. Boys will be affected, girls will only be a carrier. Depending on which step of the immune response is affected, their presentation may differ. As you can see in the photo here, I guess women are stronger than men in many ways. Now, moving on to today's final topic, HIV and AIDS. HIV is one of the world's leading infectious killers, claiming more than 25 million lives over the past 3 decades. There were approximately 34 million people living with HIV in 2010. In 2010, around 6.6 million people living with HIV were receiving antiretroviral therapy in low and middle income countries, but over 7 million others are still waiting for access to the treatment. In 2008, 2 million people died due to HIV and AIDS, and another 2.7 million were newly infected. According to the report from CDC, in the 46 states and 5 United States dependent areas with long-term confidential name-based HIV infection reporting, the estimated rate of diagnosis of HIV infection among adults and adolescents was 19.7 per 100,000 population in 2010. The rate for adults and adolescents diagnosed with HIV infection ranged from 0 per 100,000 in American Samoa and the Northern Mariana Islands to 50.4 per 100,000 in the United States Virgin Islands. 1.2 million people in the United States are living with HIV infection. However, 1 in 5 are unaware of their infection. Men who have sex with men, particularly young black men having sex with men, are more severely affected by HIV. And by race, blacks, African Americans face the most severe burden of HIV. Well, in the past, we didn't know what it is, how it was transmitted, or how to treat this condition. But now, we do know what it is and how it is transmitted. This is the diagram of HIV. HIV can be transmitted via unprotected and close contact with a variety of body fluids of infected individuals, such as blood, breast milk, semen, and vaginal secretions. Individuals cannot become infected through ordinary day-to-day contact, such as kissing, hugging, shaking hands, or sharing personal objects, food, or even water. It is composed of the following structures, importantly GP120 on the envelope and reverse transcriptase with RNA, packed together with integrase and protease within nucleocapsid. GP120 on the envelope allows the cell to bind and enter in the specific cell, CD4 T cells. And this is called tropism. Once it is bind with CD4 and co-receptor using GP120, then it will release GP41, which causes fusion of the viral envelope with the cell membrane of T cell. This will allow reverse transcriptase and viral RNA genom to be released in the cytoplasm of T cell, allowing viral cDNA to be created from viral RNA using reverse transcriptase. This cDNA migrates to the nucleus in association with the viral integrase and the VPR protein and is integrated into the cell genome, becoming a provirus. Activation of CD4 T cells induces the expression of the transcription factors NF-kappa B and NFAT, which binds to the proviral LTR and initiate transcription of the HIV genome. First, it will start producing enhancers or stabilizers of transcription. Finally, it will start replicating parts of HIV, which will be then packaged together to form many new virus particles. AIDS or HIV positive patients with low CD4 T cell count are susceptible to the following opportunistic infections and even some malignancies. They are known as Kaposi sarcoma, which is associated with HHV number 8, non-Hodgkin's lymphoma associated with Epstein-Barr virus, or it could be primary lymphoma. It can also cause an infection of parasites, bacteria, fungi, viruses, which are usually not seen by the healthy individuals, but only or commonly seen in the immunosuppressed or immunocompromised patients. When the individual is infected, it may present flu-like symptoms in the beginning in some people, but not always. HIV will slowly deplete the number of CD4 T cells, which could even take more than 10 years. Then the patient will start to show some immunocompromised status, immunodeficiency symptoms, when CD4 T cells count drops below 500. And soon developing AIDS, which is CD4 counts goes below 200. This process can be delayed by using antiretroviral therapy, referred as HAART or HAART, which stands for Highly Active Antiretroviral Therapy, which uses combinations of antiretroviral medications. This therapy targets mainly two viral proteins to arrest viral replication. These are the viral reverse transcriptase, which is required for synthesis of the provirus, and the viral protease, which cleaves the viral polyproteins to produce the virion proteins and viral enzymes. Development of vaccination or even medication remains challenging due to its rapid replication, creating 10 to the 9th or 10 to the 10th variants per day, with mutation rate of 3 times 10 to the negative 5 per nucleotide, which means this virus will keep changing its character or structures, making it very hard to come up with a specific medication or therapy or even vaccination to neutralize these viruses. Well, that's it for today, and thank you very much for listening to the presentation.